Dr. James. When a family receives a diagnosis of pancreatic cancer, the world can feel like it's spinning out of control. As a physician, I can explain the medical plan, the treatments, and the prognosis, but the person who truly anchors the patient's experience, who is there for every single moment, the triumphs, the fears, the quiet hours of the night, is the nurse. They are the constant, the linchpin of patient care. Today, we're pulling back the curtain to hear from one of these incredible professionals. This is what happens at the bedside, in the clinic, and during the hardest moments, from the expert who is always there, offering a steady hand and a wealth of wisdom. Sarah the nurse. When I walk into a patient's room, my first thought isn't about the chart or the machines. It's about the person in the bed and the family standing beside them. Pancreatic cancer is a formidable opponent, and my job is to make the journey as manageable and dignified as possible. A huge part of that starts with mastering the practical, day-to-day realities of living with this disease. It's not just about medicine, it's about making life work, 1 hour at a time. We start with the medication schedule. It can feel overwhelming: pills for pain, for nausea, for digestion. The key is to get ahead of the symptoms. We don't wait for the pain to become unbearable. We create a proactive schedule. I work with families to set alarms, use pill organizers, and even create a simple chart that we can stick on the refrigerator. It's about creating a routine that becomes second nature, so the patient isn't constantly reacting to their body's distress. Similarly, with nausea, we don't wait for it to strike. It's these small, proactive steps that give a patient a sense of control when so much feels uncontrollable. The goal isn't to force large, complex meals. It's about finding simple, tolerable foods that provide energy. I often recommend things like smoothies with a gentle protein powder, broths, scrambled eggs, or plain toast. Small, frequent snacks are often much more manageable than 3 large meals, and hydration is critical. If water is unappealing, we try weak tea, electrolyte drinks, or even ice pops. I also teach families to watch for crucial signs: a sudden spike in pain, persistent vomiting, a change in skin color, or extreme lethargy. These aren't things to wait and see about. These are signals that require a call to the medical team, and knowing what to look for empowers the family to act swiftly and confidently. One of the most important parts of my job is being a translator. I stand in the space between the patient's experience and the doctor's medical plan. A patient might say, "I just feel awful," but that's not enough information for a physician to act on. My role is to help them articulate that feeling. Is it a sharp pain or a dull ache? Is the fatigue constant or does it come in waves? Does the nausea happen after eating or first thing in the morning? I encourage families to keep a small notebook or symptom journal. Writing down the time, the symptom, and what was happening at that moment provides a clear, objective record that is invaluable to the medical team. When you, as a family member, communicate with me, be specific. Instead of saying "Mom didn't eat," try saying, "Mom had 2 bites of toast at 8 a.m. and said she felt too full to eat more." That detail tells me so much. It helps me understand if it's an appetite issue, a digestive problem, or something else entirely. This partnership in communication is how we ensure the patient's needs are met, and that leads to advocacy. My ultimate responsibility is to the person in my care. I am their voice when they are too tired or too overwhelmed to speak for themselves. I advocate for better pain management if what we're doing isn't working. I advocate for their dignity, ensuring they are kept clean, comfortable, and treated with respect by everyone who enters their room. I've had to gently but firmly interrupt a medical discussion to say, "Let's give Mr. Smith a moment. He looks uncomfortable. Do you need us to adjust your pillows?" It's about remembering there is a human being at the center of all this medical activity, and their comfort is a top priority. But this journey is about so much more than physical symptoms. Pancreatic cancer brings with it an immense emotional and spiritual weight. There's fear, anger, sadness, and a profound sense of loss. As a nurse, I've learned that one of the most powerful things I can do is simply bear witness to that pain. My job isn't to cheerlead or offer platitudes like "stay positive." My job is to sit with them in their fear and validate it. Saying, "This is incredibly hard, and it's okay to be scared," can be more comforting than any empty reassurance. We look for ways to create moments of normalcy amidst the chaos. Maybe it's helping a patient sit by the window to feel the sun on their face, playing their favorite music, or just talking about something other than cancer. We once had a patient who was a lifelong gardener. We brought in potted herbs so he could smell the mint and basil. It was a small thing, but for a few minutes, he wasn't a patient. He was a gardener again. It's about honoring the person they've always been. We must also respect a patient's spiritual or personal beliefs. For some, that means facilitating a visit from a chaplain or priest. For others, it might mean ensuring they have quiet time for meditation or prayer. And for many, it simply means creating a peaceful space. The most profound skill I've learned is to listen without feeling the need to fix everything. Sometimes, there are no words. There is only presence. Holding a hand, making eye contact, and just being there can be the most potent form of care we can offer. And now, a word for you, the family caregiver. I see you. I see your exhaustion, your fear, and your unwavering love. You are the unsung heroes in this story, but you cannot pour from an empty cup. I need you to hear me on this. You must take care of yourself. Burnout is real, and it will not help your loved one. This is not selfish, it is essential. Take a walk, see a friend for coffee, read a book for 30 minutes. Accept help when it is offered. If a neighbor offers to bring dinner, say yes. That symptom journal I mentioned, it's not just for the doctors, it's for you. It helps you organize your thoughts and frees you from the burden of having to remember every single detail. It's also okay to step back. There will be times when a medical situation is beyond what you can handle at home. That is when you call us. That is when you let the professional team intervene. You are not failing. You are being a wise and responsible caregiver. Your role is to love, to support, and to be present, not to be a one-person medical team. Let us carry the clinical burden so that you can focus on being a spouse, a child, a partner, a friend. She pauses, a reflective and poignant look on her face as she prepares to conclude. People often ask me how I can do this work, day in and day out. They see the sadness and the loss. And yes, that is part of it. There are days that are incredibly challenging, days that break my heart, but that's not the whole story. The reward is in the profound human connection. It's in the trust a patient places in you, in the shared glance with a family member that says, "Thank you for being here." It's in the privilege of walking alongside someone on the most vulnerable journey of their life. Caring for a pancreatic cancer patient isn't about winning a battle or achieving a cure, though we always hope for the best. It's about honoring their journey, every single day. It's about ensuring that each day has as much comfort, dignity, and meaning as possible. It is a privilege to do this work, to ease a burden, to offer a steady hand in the storm. It is a profound reminder that at the end of it all, the most important thing we can do for one another is simply to care.